Hi, everyone. My name is Brittany Che. I'm one of the administrative fellows at Staten Island University Hospital. Today, I'm going to be presenting our study, Effect of a Nursing Hold Team on Patient Satisfaction for Emergency Department Boarded Patients. Emergency departments across the United States face many challenges related to patient volume, available capacity, and patient throughput. Patient satisfaction is often adversely affected by ED crowding and boarding times. Boarded patients also compete with new ED arrivals for resources such as nursing availability. In order to mitigate some of these challenges, our ED was able to implement a dedicated nursing hold team for boarded patients who were admitted but remained in the ED. The nursing hold team is comprised of a minimum of 3 nurses who are staffed in the ED 24/7 and are able to care for patients at the same nursing to patient ratio as on the inpatient unit. When resources are available, a 4th ICU critical care nurse is also staffed for boarded ICU patients or can be repurposed as a 4th general hold team nurse when critical care volume is low. The goal of this study was to determine whether or not the implementation of a nursing hold team would improve patient satisfaction scores for patients admitted and subsequently discharged directly from the ED. This was a retrospective observational study that looked at the Press-Ganey surveys of all patients who were admitted and remained in the ED for the entirety of their admission. Any patient who was later moved to an inpatient floor was excluded from our study. We analyzed 2 12-month periods before and after the implementation of the nursing hold team. Our primary outcome was the percentage of patients who gave a top box Press-Ganey score in the nursing communication domain. During the pre-implementation period, 59% of patients gave an overall top box rating versus post-implementation, where 66% of patients provided a top box rating. We also examined the questions individually, and as you can see in the chart, we found an overall trend towards increased Press-Ganey top box ratings after the implementation of the nursing hold team. In conclusion, implementing a dedicated nursing hold team demonstrated an increase in the overall top box Press-Ganey nursing communication domain score, as well as in several of the individual domain questions. Future studies should examine other benefits that can be derived from a nursing hold team, such as rates of adverse events and medication delays for admitted patients boarding in the ED. Thank you so much for your time, and I'd be happy to answer any questions.